Welcome to Usmle World, where we ask, answer, and explain Usmle questions. Today, we're diving into Step 2, Surgery, focusing on orthopedics. Let's get started with question number 1. For the following case, which of the following is the best next step in management of this patient? A. Ankle splinting and non-steroidal anti-inflammatory drugs. B. Immediate surgical fixation. C. Intraarticular aspiration. D. MRI of the ankle and foot. E. X-ray of the ankle. The case scenario is: a 26-year-old man comes to the emergency department for evaluation of right ankle pain. The patient was playing basketball when he jumped in the air and landed on his friend's foot. The patient rolled his foot immediately and immediately fell to the ground. He tried to walk off the basketball court by himself but was unable to take steps or bear weight on the foot. Blood pressure is 110/80 and pulse rate is 76 per minute. BML is 20 kg per meter square. The lateral aspect of the right ankle has significant swelling and tenderness to palpation over the lateral malleolus. There is no bruising and no tenderness to palpation over the anterior aspect of the foot. The patient can plantar flex and dorsiflex the ankle. Sensation is normal. The question is: which of the following is the best next step in management of this patient? Your options are: A. Ankle splinting and non-steroidal anti-inflammatory drugs. B. Immediate surgical fixation. C. Intraarticular aspiration. D. MRI of the ankle and foot. E. X-ray of the ankle. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is E, which is X-ray of the ankle. This question is designed with the focus to assess your ability to implement mixed management. This patient has a lateral ankle injury caused by forceful inversion of the foot, which commonly occurs with running, walking on uneven surfaces. Example: descending stairs, or a fall from a height. Most ankle injuries are caused by sprains, in which the ligaments are injured but the bones remain intact. Uncomplicated sprains are typically managed conservatively. However, orthopedic intervention may be required if a bony fracture is present. The Ottawa ankle rules were developed to determine which patients require imaging to rule out an ankle fracture. These rules have high sensitivity, up to 99%, for detecting fracture and can help reduce the number of unnecessary radiographs. Plain radiographs of the ankle are indicated in patients with pain in the area of the malleolus in association with either point tenderness over the posterior margin or tip of the malleolus, as in this patient, or inability to bear weight after the injury and for 4 steps during medical evaluation. Further management depends on presentation and X-ray findings. Immediate orthopedics consult is indicated for any open fracture or in those with evidence of neurovascular impairment. If you choose any option other than E, you are wrong. Let's briefly discuss the other options. A. Ankle splinting and non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are effective for acute ankle pain, whether due to sprain or fracture. However, this patient has clear indications for ankle X-ray, and simple splinting may not be adequate management. B. Immediate surgical fixation. If X-ray reveals a distal fibular fracture, most cases can be managed with a hard, example plaster, fiberglass, or soft, example air cushion, splint. Surgical intervention is considered for some proximal fibular fractures as well as for complicated, example comminuted, spiral, distal fibular fractures. C. Intraarticular aspiration. Ankle aspiration is usually done to evaluate suspected septic or crystalline arthritis. Typical features include erythema, swelling, warmth, and fever. D. MRI of the ankle and foot. MRI can visualize the ligaments of the ankle, but it is expensive and rarely needed for acute evaluation of ankle sprains. MRI may be considered to rule out a concomitant talar fracture in patients who do not improve as expected in 6 to 8 weeks, but X-ray is the preferred initial imaging study. Your take-home message from this question is that ankle pain after trauma may be caused by a sprain or fracture. The Ottawa ankle rules are used to help determine which patients require imaging. X-ray of the ankle is indicated for patients with pain in the malleolar region in association with either 1. Bony tenderness at the posterior margin or tip of the lateral or medial malleolus, or 2. Inability to bear weight. Nailed the answer? Great! Click above to level up. Still learning? Rewatch and get it right next time. Understanding is your key to success. Unlock your Usmle and medical exam dominance with our awesome resources. Share the knowledge, hit that like button, and subscribe for medical exam mastery. Your future doctor self will thank you.